Alright, so now we're doing part 2 of my physical assessment video, the lying down portion. I would start this portion out by doing the lying down portion of the breast exam. So I would place a pillow behind her back, have her lift her arms above her head. We would palpate all 4 quadrants of both breasts and upper telespans, looking for any lumps or abnormalities there. Then I would explain to her the self-breast exam, when to do it, usually the same time every month, do it monthly, usually after your period. And then I would teach her the ways. You could either do the vertical method, which covering the entire breast going up and down. Then we have the circular method, starting the nipple, and just making circular motions around to cover the entire breast. And then the wedge, starting from the nipple and going out. And just always making sure they hit the tailspins. And then tell her she could also look in the mirror, lean forward in the mirror, looking for any dimpling or any kind of non-symmetry or anything like that. And if she saw anything, go ahead and come back in and get checked out. So now we're going to look at her chest, her anterior chest. So we're going to look, you mind if I lift this up just to see her coastal angle a little better. You can see this, it looks less than 90 degrees. No visual retractions or bulges. So I'm going to go ahead and listen for her breath sounds. Alright, so her breath sounds sound clear. So now I'm going to palpate the pericardium. I'm just going to inspect and palpate the pericardium. So again, normally her clothes will be removed, but then I'm going to just feel around for any heaves or thrills, pulsations, anything like that. No apparent. Then I'm going to try to feel and palpate the point of maximum impulse, which is usually fifth intercostal space, midclavicular line on the left side, and that's just going to be where I would feel the apical pulse. So now I want to auscultate her heart sounds. Listening to the aortic, pulmonic, herbs, tricuspid, and mitral area. Then I will go through and listen with the bell. Same spots, aortic, pulmonic, herbs, tricuspid, and mitral. So S1 and S2 sounds are definitely heard in all spots. No S3 or S4 sounds. No apparent murmurs upon auscultation. So we'll go ahead and move on. I can actually assess her apical pulse rate. So I would listen to the same place I felt her PMI, so it will be her fifth intercostal spot, midclavicular line on the left side. I would listen for I would want to listen for a solid minute, listening for rate, rhythm changes, hopefully finding a regular rhythm and a pulse rate between 60 and 100. Then I'm going to move, after that, we'd move on to the abdomen. So then I would look at her abdomen, looking at the skin, contours. Skin looks pretty intact, no obvious skin lesions. Contours, it's flat, no signs of herniations or anything, just by looking. So I'm going to go ahead and listen to bowel sounds. So I would warm the stethoscope up with my hand here. Listening for bowel sounds in all 4 quadrants. Bowel sounds are active. Then we're going to go ahead and switch the bell. We're going to listen to the aorta, the renal arteries, iliac and femoral arteries to make sure there's no signs of any bruise or anything in there. So go ahead and listen. The aorta, the renal arteries, the iliac, and the femoral. And normally what I would listen to for femoral arteries, of course I'll do it on the actual scan, but for the video purpose we'll leave her covered up. I did not hear any bruise upon auscultation, so we'll go ahead and percuss the stomach. So we'll start. I'm just going to lightly tap, okay? Alright, timpani her pretty much over all the stomach, maybe a little dullness over the liver areas, but no issues there. So now I want to assess her liver span. So what I'll do is just start down here in her stomach and just listen for the dullness. So about right in that area, I would mark it. We're looking at the midclavicular line here on her right side. Then I would start up here, and once again I won't uncover her for the video purposes, but I'll start up here and work my way down until I went from the normal sound above the lung fields to the dullness of the liver. Would mark the two, would measure. I think the normal range is like 6 to 12, looking for any kind of liver enlargement or maybe misposition of the liver. Then after that, we'll go to some light palpitations. Go ahead and flex your knees up for me. I'm gonna lightly palpate. You just tell me if you have any pain with any of this. Any pain at all? Okay, and I don't feel any abnormalities. So we'll go ahead and we'll do a deep after this. So I'm gonna go a little deeper this time. It's gonna be a little more pressure. Any pain there? I'm going to check for some rebound tenderness. So you tell me, I'm going to push in and you tell me if you have any pain after I let up, okay? No. Any pain with that? Any pain there? Okay. So no rebound tenderness. We'll go ahead and assess the liver. So I'm going to feel the bottom border of the liver. You tell me if you have any pain whenever I stop it, okay? And so there that is. Any pain there? Okay. No sign of any liver enlargement. And she said no pain. So we'll go ahead and we will palpate for the any of the aortic pulsations in the stomach. So we're gonna go midline here, and you can lightly feel a small pulsation in her stomach. She's pretty thin, so we kind of expect that. Then we're gonna check for diastasis recti by just using your fingers here and feeling for any kind of separation of these abdominal muscles. And it doesn't appear to be separated at all, so no signs of that. Okay, so we'll go ahead and you can straighten your legs out and go ahead and we'll check your femoral pulse. So I would, once again, when you're going into this with, under the clothes, but I would check for a femoral pulse. That's 2 plus. We do the same to the other side. Then we're going to check for the renal lymph nodes, checking the superficial, any pain. no apparent swelling, and then we'll do the inferior, the inside of her leg, no pain there. Then we're going to look for any kind of herniations. So I'll feel around her belly button. You lift your head up for me, try to flex your abdomen. No issues there. And we'd also look for femoral herniations in that area. Another thing we'd want to listen for is the venous hum around the umbilical with the bell of the stethoscope, just for any kind of venous hums. And none are noted there. So now we'll go ahead and move on to her lower extremities. You can go ahead and cover up. Normally you would look at your entire legs. She's going to set up for video purposes so she can get all of her legs in the screen. But then you would look at her legs looking for any kind of lesions, seeing if it's intact, looking for any kind of venous insufficiency, any varicose veins, anything like that, stasis ulcers, anything along those lines. Then I'll go ahead and move to her lower extremities, her feet. I'm going to remove her socks real quick. Get your other one for you. And then I would feel for her dorsalis pedis pulses. And those are 2 plus bilaterally. We'll go for the posterior tibial. And those are 2 plus as well. So then we, of course, we're going to check cap refill, but her toenails are painted, so we're unable to do that right now. So that would conclude the laying down portion of our physical exam. If I had a male patient, I would have them stand up and check their genitalia. I would inspect the penis, the scrotum, urethral meatus, pubic hair distribution, things like that. And I would palpate the penis for any tenderness or indurations, abnormalities of any kind there. Palpate testes, the epididymi. It's a tough word to say. Then I would go to the vas deferens, just feeling for enlargement, any kind of tenderness, any masses there. Then I would do the premasteric reflex, where I would take some kind of like the back of a reflex hammer, like some kind of dull, and just touch the inside of their thigh, looking for testicular rise, doing that bilaterally. Then I'll explain to them when to do their testicular self-exam, usually same time every month, in the shower, using your thumbs and your 2 fingers here, doing 1 test foot at a time, just rolling around, feeling for any kind of lumps. And that'll conclude my head-to-toe physical assessment for nursing 641. Thank you.